Hello,
Hello, Sharon. How are you?
I'm fine, but I have some news for you. Well, as everybody knows, the world is going through a crisis of a great magnitude because of the spread of the COVID-19 virus, and to prevent this disease from spreading further, the state has opted for quarantine, which is why people now work and study and do multiple activities from home. And I have a question for you. What do you know about the coronavirus?
Okay, let's talk about coronavirus. Coronavirus are an extensive family of viruses that cause disease in both animals and humans. In humans, several coronavirus are known to cause respiratory infections that can range from a cold to more serious illness such as respiratory syndrome and then the death. The most common symptoms of COVID-19 are fever, dry cough, and tiredness. Some people have no symptoms and are only contagious. The most defenseless against the virus are adults and other people. The disease is spread mainly from piercings to person, throat, particles thrown from the nose or mouth of an infected person by coughing, sneezing, or talking. And now tell me, how serious is a pandemic disease? What do you think about that?
Was the threat of a severe influenza pandemic is real? A mild pandemic might appear to be reverse seasonal flu epidemic, but a severe pandemic could result in an economic and social catastrophe. Although it's not possible to prevent a severe pandemic from reaching your local area, global governments and their leading teams are prepared to reduce the impact. If a country is not prepared, a severe pandemic will not only cause many flu cases and deaths, but will also impact the country, governments, and families financially. The central government alone cannot prepare the nation for an influenza pandemic. This challenge requires our help. And what about this question? Who World Health Organization is known to have developed food and exercise tips to help people in quarantine. What do you know about that? And what food and exercise is good in these times?
Um, the World or the World Health Organizations recommend that we exercise as many benefits such as helping us control weight and decrease the risk of heart disease and exercise the lungs. Regular physical activity is beneficial to both to the body and the mind. Now, with the situation of the pandemic and quarantine, the World Health Organization recommends that we stay active at home with antivirus such as activities such as climb the stairs as many times as possible, use household chores to stay more physically active, do fun activities like dancing, follow physical exercise classes online, or perform muscle stretching activities, lifting weights, or using your own body weight. And how about this question? What can government to do prevent and slow down transmissions?
Well, the local government are unlikely to have two enough antiviral drugs, and it's not expected that vaccine can be manufactured until after the first wave of the pandemic. However, it has been shown that practicing good hygiene and social distance strategies, which are designed to keep people away from each other, can dramatically halt the spread of the virus. Interventions such as good hygiene practices and social distancing strategies are called non-pharmaceutical interventions because no drugs are used. Interventions can be used one to delay the onset of the pandemic, thus allowing more time for final preparedness activities. To decrease the period of maximum intensity of the impact, thus reducing the overload of the health care sector and the percentages of absenteeism from work. Three, to reduce the total number of sick and diseased people due to illness.
Yes, I agree with you.
Do you think scientists or virologists will find a cure for the coronavirus?
Well, I think to the date there is not a specific vaccine or antiviral against COVID-19. Possible cure are being investigated in different countries, specific pharmacological treatments. There are also clinical trials to test them on animals or people. World Health Organization is coordinating efforts to develop vaccines and drugs to prevent and treat the COVID-19. Recently, a Chinese laboratory has a proposal for the coronavirus vaccine that has been a success in monkeys, but they have not yet that continue doing more clinical tests. And what do you think about the final questions? In your opinion, what are the main challenges to COVID-19 brings to our healthcare system?
Well, COVID-19 challenged the ability to health system to respond to an out of the ordinary numbers of patients who need the same services. Not only hospitals are overwhelmed, also other areas of care or assistance, such as the availability of medical supplies or a labor force is exhausted. Currently, the government is managing to obtain specialized equipment from abroad to treat patients in the ICU area, and it's doing everything possible to obtain the necessary resources to safeguard people's life. Well,
Well,
that's the
that's all.
information that I have.
Yes, take care
Now,
and remember to stay hot.
well, as we already know a little bit about this virus, we know what we have to do. And that's all, I think.
That's all. Goodbye, Sharon. Take care and remember to stay home.
Okay, I will do
Okay,
that.
goodbye.
Bye bye.
Bye.